All right, the final assessment we're going to do is the cranial nerves and deep tendon reflexes. To start off with, we're going to test cranial nerve number 1, which is the olfactory nerves. I'm going to have the patient include one of his nostrils, and he is going to smell this for me, and then do the other side. And what do you smell?
Vanilla.
That tells me that his olfactory nerve is working. He was able to appropriately smell on both sides, and both nostrils are pain. Next, we're going to do the optic nerve number 2. So I'm going to have the patient take one of these and cover his eyes. I'm going to cover on the same side, and I'm going to test his peripheral vision. Tell me when you can see my fingers wiggling.
Yep. Yep. Yep.
And the other side?
Yep. Yep. Yep.
Okay. Cranial nerve number 2 is working. Next, we're going to go to cranial nerve 3, 4, and 6, the ocular motor, the trochlear, and the abducens. So to test this, I'm gonna look at his eyelids and make sure everything is symmetrical. There's no drooping, there's no lagging on either side. I'm gonna also do the cardinal fields. So I'm gonna have the patient look straight ahead, don't move your head. I'm gonna have you follow my fingers with your eyes only, no head, okay? Okay. Any difficulty?
No.
The patient had no lagging on either side, and he was able to follow appropriately with each of his eyes. Next, we're going to test the cranial nerve number 5, which is the trigeminal nerve. I'm going to place my hand on either side right here, and I'm going to have him clench his jaw really tight, open, close. And it's symmetrical. There's no pain or tenderness, correct?
Correct.
And I'm able to feel equal movement on both sides. Next is the facial nerve. So I'm going to have the patient raise his eyebrows, smile really big, frown, blow out your cheeks, and then can you furrow your eyebrows? Close your eyes really tight. He's able to do all of those movements. It's symmetrical. There is no lagging, which tells me that his facial nerves are intact. The next is going to be the acoustic nerve, cranial nerve number 8. So I'm going to have the patient turn around, and I'm going to be about arm's length away. I'm going to have him cover one of his ears, and I will whisper and have him repeat it back to me.
Hockey.
Do the other side.
Football.
And he appropriately was able to repeat those back to me, which tells me that his acoustic nerve is working appropriately as well. You can come back towards me. Cranial nerve number 9 is the glossopharyngeal nerve, and 10 is the vagus nerve. I'm going to have the patient open his mouth. If I had a tongue depressor, I would put that and kind of put it on the back of his tongue to keep his tongue down so I could visualize his uvula and make sure everything is midline. There's no redness, no swelling, and no white spots or anything like that. As far as I can tell, patient does not have anything. His uvula is midline and no redness, no swelling. Can you swallow?
Yes.
Any pain or difficulty swallowing?
No. So
his cranial nerve number 10 is intact as well. 11 is going to be the spinal accessory nerve. So I'm going to put my hands on the patient's shoulders, and I'm going to have him shrug up. All right. And then can you look this way towards me? All right. And this way. Perfect. He is able to do that with equal strength on both sides. There's no lagging or anything. So it tells me that his spinal accessory nerve is intact as well. Number 12 is the hypoglossal. I'm going to have you open your mouth and stick your tongue out. Are you able to move it around? And his hypoglossal is intact as well. Next, we're going to do the deep tendon reflexes. So I'm going to have you take a seat on that stool right behind you. I don't have a reflex hammer on me. I haven't had much success, so I'm gonna just try using a spoon here. I think you can also use the bell of your stethoscope. So the first reflex I'm gonna try is the brachioradial. Okay, it's a +2 reflex. The next one I'm going to try here is the brachial reflex. I say a +2 as well. Just relax your arm. Minimal movement there. We'll say like a +1. All right, just relax your leg here. I don't know if you need to see. All right, so I'm going to just gently tap right here. A little bit of reaction. One more time. Okay. And the last one we're going to do is the Achilles here. So I'm going to have him kind of pull his feet up like that, and he should do a plantar motion after I hit the back of his Achilles here. +2 there. And that concludes the cranial nerve and the deep tendon reflexes assessment.